Namaste. Welcome to our channel Mbdh Wellness. We hope you are doing well and are in good shape and health. Today we are here with another video and are going to talk about low potassium. Low potassium, its signs, symptoms, causes and treatment. If you have hypokalemia, that means that you have low levels of potassium in your blood. Potassium is a mineral your body needs to work normally. It helps muscles to move, cells to get the nutrients they need, and nerves to send their signals. It's especially important for cells in your heart. It also helps keep your blood pressure from getting too high. So, what are the causes of low potassium? Well, there are many different reasons you could have low potassium levels. It may be because of too much potassium is leaving through your digestive tract. It's usually a symptom of another problem. Most commonly, you get hypokalemia when you vomit a lot, you have diarrhea, your kidneys or adrenal glands don't work well, you take medication that makes you pee. It's possible but rare to get hypokalemia from having too little potassium in your diet. Other things sometimes cause it too, like drinking too much alcohol, sweating a lot, folic acid deficiency, certain antibiotics, diabetes, ketoacidosis, laxatives taken over a long period of time, eating disorders, some asthma medication, or low magnesium. Several syndromes can be associated with low potassium, such as Cushing's syndrome, Gentleman syndrome, Liddle syndrome, Bartter syndrome, Fanconi syndrome. Do you know women tend to have hypokalemia more often than men? Now we'll talk about the symptoms. If your problem is temporary or you are only slightly hypokalemic, you might not feel any symptoms. Once your potassium levels fall below a certain level, you might experience weakness, fatigue, muscle cramps or twitching, constipation or abnormal heart rhythms. Hypokalemia can affect your kidneys. You may have to go to the bathroom more often. You may also feel thirsty. You may notice muscle problems during exercise. In severe cases, muscle weakness can lead to paralysis and possibly respiratory failure. Now, we're going to talk about diagnosis. You will need a blood test for your doctor to find out if you have hypokalemia. They will ask you about your health history. They'll want you to know if you had any illness that has involved vomiting or diarrhea. They'll ask about any conditions you might have that could be causing it. You may also need to take a urine test so your doctor can find out if you are losing potassium when you pee. Since low potassium sometimes can affect your blood pressure, your doctor will check that too. They also may want to do an electrocardiogram if they think you may have arrhythmia. This is one of the most serious side effects and might change the way your doctor chooses to treat your problem. Now comes the treatment part. You can get more potassium by simply taking more supplements. Most of these you can take by mouth. In some cases, it's necessary to get your potassium injected by IV. For example, if your potassium level is dangerously low, if taking supplements don't raise your potassium levels, if your low potassium levels cause abnormal heart rhythms. When your hypokalemia is a result of another medical condition, your doctor will help you treat that. Always check with your doctor before you stop any medicine. Also, ask them before you take any potassium supplements. This might cause too much potassium to build up in your system, which could lead to hyperkalemia. We hope you found this video helpful and are going to recommend it to your friends and family. Do let us know about any more health tips or suggestions you have related to low potassium. Comment these simple tips or remedies in the comment section below. Do like, share and subscribe our channel. Namaste. Thank you.